One of the biggest things that you take an interest in is in thyroid cancer, medullary thyroid cancer in particular. You've got a new study. Tell me, what were you trying to do in this new study, which is, I gather, in the real world?
Yes, it is. Medullary thyroid cancer is a very rare disease. In fact, in Spain, it is estimated that only 50 patients are newly diagnosed per year. We have reported a study in which we use vandetanib in an expanded access program to treat these advanced medullary thyroid cancer patients in Spain. In these 27 patients that we treated, we have seen that the median PFS, the median progression-free survival for these patients, is about 17 months. That is extremely high for this patient population.
Now, that was with what protocol and what are the characteristics of this study?
They are progressive. They are patients under progression when they started treatment with vandetanib. In fact, only 60% of the patients were treated with vandetanib for the first-line setting, but 40% of the patients received vandetanib for the second or subsequent lines of treatment. And we didn't see any major differences in terms of activity.
What were the options for these patients otherwise?
Before vandetanib, only chemotherapy, but you know, chemotherapy didn't work at all in these patients, a median PFS of only 4 to 6 months.
Can you spell out then the increment in PFS, in progression-free survival?
More than 1 year in differences in median PFS from chemotherapy, from retrospective studies in chemotherapy to what offer vandetanib to these patients.
Now, this is with a multi-kinase inhibitor. Is it in any way difficult to give such a powerful drug inhibiting so many kinases?
We are learning how to deal with the side effects of vandetanib. Vandetanib is inducing skin toxicity, diarrhea, mucositis, hypertension, and QTc prolongation. However, we are knowing how to deal with all of these side effects, and medical education and patient education is critical to deal with all of these side effects.
Now, it seems you're getting really good results in the real world. How does that study fit in with the other studies of vandetanib and in the use of medullary thyroid cancer?
You cannot compare the results from the CETA trial, that is the phase 3 pivotal trial that gave the approval for vandetanib in this indication. You cannot compare directly the results of these trials. However, there is a similar experience of the French group. The French colleagues has performed exactly the same analysis that we did, and we found exactly the same figures in terms of PFS, in terms of response rate, and in terms of dealing with the side effects.
Will you interpret this for me in terms of what doctors need to do with their patients with this relatively rare cancer?
Yes, the French and the Spanish experience in the real world setting with vandetanib is what the physicians can expect from the drug in the real when they are treating their daily clinical office patients.
So they can expect it's going to work?
They can expect vandetanib is working. They can expect a median PFS of about 1.5 years, that is extremely high, and they can expect side effects, but they are manageable.
What alternatives might these patients have in the future? Is there anything else coming down the road?
Yes, it's coming. Cabozantinib is a drug that is from Exelixis, a biotech from California, and cabozantinib is in the regulatory process for authorization, and we will see in the future what is the best sequencing strategy to offer to our patients.
So what's the clinical bottom line message for doctors right now?
MTC, medullary thyroid cancer, under progression, is a rare disease. They have to be referred, if possible, to centers with experience in the field. However, there are at least one tyrosine kinase inhibitor that is clearly impacting in the natural history, is clearly impacting in the overall survival of these patients.